Hello everyone. In this particular video, we would be looking at cervical incompetence. So, this is a very important topic, and in this video, we would be covering the definition, causes, diagnosis, and treatment, and specifically the principles of cerclage operation. Yeah, so that would be the main one, cerclage, of what it entails. Yeah, coming to the definition. Cervical incompetence refers to the inability of the cervix to retain a pregnancy in the absence of uterine contractions or labor. So, as you can recall, it is one of the causes of abortions. So, it is characterized by painless cervical dilatation leading to recurrent mid-trimester pregnancy losses or preterm births. So, painless cervical dilatation leading to recurrent mid-trimester pregnancy losses or preterm births. Yeah, so this should be pretty clear what it means. So we'll just take a look in case there are any good diagrams. So here you can see how it looks like. So cervical insufficiency, and the baby will come out very easily in case this is present. Yeah. So coming to the causes. So there are congenital causes, acquired causes, and other causes. So congenital. So Mullerian duct anomalies, which are bicornuate septate uterus, connective tissue disorders like Ehlers-Danlos syndrome. I think this is collagen 3 mostly. Ehlers-Danlos syndrome. Yeah, there are different types. So mainly it's collagen based. That is what it is, autosomal dominant. Can't tell exactly, but yeah, it's a collagen synthesis issue. Now elastin is the other one. Yeah, so yeah, acquired causes, iatrogenic trauma from DNC procedures. So this comes under acquired causes. Cervical surgeries, which are cone biopsies, tracheolectomies, amputation of cervix, these. And then there are vaginal operative deliveries through undilated cervix. So acquired causes include trauma because of DNC, cervical surgeries, which are these, vaginal operative deliveries through undilated cervix. Finally, coming to the other causes, multiple gestations, history of preterm birth or prior mid-trimester losses. Yeah, so these are the causes. Coming to the diagnosis. So we look at the history, we do the internal examination, then there are imaging and special tests. So history, the recurrent painless cervical dilatation during the second trimester without uterine contractions. So dilatation without contractions, escape of amniotic fluid or painless expulsion of fetus in previous pregnancies. So previous history of fetal loss, and it is painless. That is the keyword everywhere. It is painless. Painless cervical dilatation in the absence of uterine contraction. Yeah. So next coming to internal examination, enter conceptional period during that, and then there is during pregnancy. So let's look at interconceptional period. So between the pregnancies, bimanual examination may reveal unilateral or bilateral tear or gaping of cervix up to the internal os. So unilateral or bilateral tear or gaping of the cervix up to the internal os. So can you imagine how it looks like? So then there is passage of Hagar dilator number 68 without resistance, indicating incompetence. So Hagar dilator, it passes through very easily without dilatation, without this one resistance. Next, coming to during pregnancy, speculum examination, what does it reveal? Painless cervical shortening and dilatation. So this should happen during this one, right? What is it? During the labor process itself. Can you recall the labor process, the different stages of labor, the stage 1 of labor where the cervix is getting prepared? Yeah, over there this should happen, but it is not the case here. Here it is during the pregnancy. Sonography, cervical length less than 25 mm, funneling of the internal os greater than 1 centimeter. So cervical length, that's what we look at. Funneling of internal os greater than 1 centimeter, and incompetent cervix may appear Y-shaped, V-shaped or U-shaped, Y, V or U. Cervical length less than 25 millimeter, funneling of internal os greater than 1 centimeter. Incompetent cervix may appear Y, V or U shaped. Finally, the imaging and special tests which are specifically for cervical incompetence. The premenstrual hysterocervicography shows funnel shaped shadow due to soft internal os. So, let's look at this one in case if it is visible. Yeah. So, here you can see funnel shaped. Yeah. Even here you can see the funnel shaped. Yeah. Due to soft internal os. Hysterosalpingography may detect anatomical abnormalities or incompetence, and speculum examination detects dilatation of internal os, herniation of membranes. So, mainly imaging studies detect the incompetence very easily, and specifically here there is this term funnel shaped shadow, and over here there is herniation of membranes. So, let us look at this once before we move on to the next one. Yeah, so here you can see how this looks like, inferior field of the placental membranes. Coming to the management of cervical incompetence, it can either be conservative or surgical depending on severity of the incompetence and patient history. So, conservative management and the surgical management, which is here. Yeah. So, conservative, bed rest, advising the patient to avoid activities that increase the intra-abdominal pressure, and progesterone supplementation, 17 alpha hydroxy progesterone caproate, very long name. Yeah, 500 milligrams IM weekly, especially if cervical incompetence is a part of preterm birth syndrome. 17 alpha hydroxy progesterone caproate, 500 milligram IM weekly. So, if it is a part of this one, preterm birth syndrome. So, let us take a look. Preterm birth syndrome, maybe it is like preterm birth is like genetically or repeatedly seen in these women. That is the case most likely. Multiple causes, preterm birth. Yeah, it is just preterm birth, that is it. Just take it as preterm birth. Yeah, use of natural micronized progesterone vaginal suppositories may help. So, basically progesterone supplementation, these are the two ways, one is IM, other one is vaginal suppositories. So, next one, vaginal pessary to support the cervix if shortening is detected on ultrasound. So, pessary, let us look at vaginal pessary. So, here you can see how a pessary is being used to support the uterus, cervix. Surgical treatment, which is known as cervical cerclage. It is the placement of suture around the cervix to prevent premature opening. So, types of cerclage operations. So, first one is McDonald's, next one is Shirodkar's. So, these are the two cervical operations. So, let us go through this, then we will check out the image. So, a purse string suture using Mercilin tape is placed at the level of internal os. The suture starts at the anterior lip of the cervix and encircles the cervix near the vaginal epithelium. The operation is simple with less blood loss and minimal scarring. So, that is the key over there. So, let us look at the image. So, not that. Yeah, so this is the one. Yeah, this one. And finally, the anterior. Finally, the vaginal epithelium is also covered near the it's covering near the vaginal epithelium, and it starts at the anterior lip of the cervix. Yeah, coming to Shirodkar's operation, let us make it like this. This one, McDonald's versus Shirodkar's. Yeah, then it will be better to understand. Involves posterior vaginal speculum for better exposure. A transverse incision is made on the anterior. Here there is an incision that is made on the anterior vaginal wall below the bladder. The non-absorbable suture is placed around the internal os using Marcelline tape. The suture ends are brought through the posterior incision. So, let us take a look. McDonald's versus Shirodkars. So, McDonald's, so this is how it looks like. They are doing something like this. Starts with anterior lip and it is Marcelline tape at the internal os, and this is something that is being done. In Shirodkars, it is not showing, and not over here. Yeah, there is nothing like, yeah, Shirodkars. So, here it is placed here, and the trapped mucus also helps, and there is occlusion suture too. Let us look at it. Involves posterior vaginal speculum for better. This one, a transverse incision made on the anterior vaginal wall below the bladder. Non-absorbable suture is placed around the internal os using Marcelline tape. The same thing. Suture ends are brought through the posterior incisions. Yeah, so these are the descriptions of cerclage operations. Coming to the principles, maybe, so this one, prophylactic cerclage done around 14 weeks or at least 2 weeks earlier than lowest period of previous miscarriage. Emergency cerclage performed if the cervix is already dilated or there is bulging of membranes. And then case selection. So, based on careful history and examination, suggesting cerclage in cervical incompetence. An ultrasound indicated cerclage is performed if short cervical length less than 25 mm is detected sonographically. So, overall prophylactic around 14 weeks or at least 2 weeks earlier than lowest period of previous miscarriage. Emergency if it is already dilated and there is bulging of membranes, and case selection based on careful history and physical examination. Ultrasound indicated cerclage is performed if short cervical length is detected. So, we have looked at this one. Then there is post-operative care, there is immediate care, medications and advice on discharge. So, immediate care, bed rest for 2 to 3 days, weekly injections of the medicine. Which one is it? IM 17 hydroxyprogesterone caprolate for women with a history of preterm delivery. Medications, isoxsuprine 10 milligram tablet may be given thrice daily to avoid uterine irritability. Probably this is a it reduces uterine contraction. I think that is the beta 2 vasodilators. This is a vasodilator, is a beta 2 adrenoreceptor agonist. So, it is a relaxation of the, so involved relaxation of uterus and vascular smooth muscles. So, vasodilation and relaxation of uterus. So, we do not want contraction, opposite of oxytocin, that is what it is. Advice on discharge. Avoid intercourse and rough physical activity, report any signs of vaginal bleeding or abdominal pain, periodic ultrasound to monitor fetal well-being and cervical integrity. Avoid intercourse and rough physical activity, report any signs of vaginal bleeding or abdominal pain, periodic ultrasounds to monitor fetal well-being and cervical integrity. Next, coming to removal of sutures. So, this is afterwards. Timing, it is usually removed 37 weeks or earlier if labor starts or signs of abortion. If not removed on time, uterine rupture or cervical tear may occur, because you want the baby to come out from the canal, not from anywhere else. If these happen and the baby starts coming from other places, meaning the pressure builds up, not directly, but the pressure is built up. Complications of removal, increased chance of cord prolapse, especially in cases of floating head. So, cord prolapse is a complication of removal, that is what we need to keep in mind. Complications of cerclage during operation, rupture of membranes, because using stitches, sutures and all that, uterine perforation, cervical lacerations. Post-operatively, infection like usual, cervical scarring leading to dystocia in future deliveries. Dystocia, we know it is abnormal labor, preterm labor or abortion. Coming to contraindications for cerclage, intrauterine infection is number 1, ruptured membranes that is number 2, vaginal bleeding that is number 3, cervical uterine severe uterine irritability, cervical dilatation greater than 4 centimeters, fetal death or defect. So, that is 5. So, these are the contraindications. You do not do it in these cases. Next, coming to alternatives to cerclage, bed rest, progesterone therapy, pessary. So, this was this one, right? What is that? Conservative. So, same thing, conservative. Prognosis, it is favorable and timely if appropriate management is done. Success rate is almost 80% with cerclage procedures. The overall prognosis is good even without therapy if the condition is managed properly. Reassurance and TLC, tender loving care, psychological support plays a significant role in improving outcomes. So, with this we come to the end of the video on cervical incompetence. So, in case you like this particular video, you can like it. In case you would like to discuss more about it, you can write it in the comments or wherever you please. Bye bye.